I'm Eric Parker. This morning on CT21, vaccines to protect kids from COVID. They could be available in the next month. So what do parents need to know? We're talking with the Yale doctor in charge of clinical trials for the Pfizer vaccine for kids right here in Connecticut. And an important step to ensure pensions for state workers are funded. State Comptroller Kevin Lembo talks about the $1.6 billion that'll be added to the pension system this fall and why that's so significant. Plus toys. We've been hearing the warnings that supply chain problems may make it harder to find what you're looking for this holiday season. We'll get a reality check and some suggestions on strategies from the owners of 2 Connecticut toy stores. It's all ahead this Sunday, October 3rd. CT21 starts right now.
From Channel 3, this is Connecticut's most watched current affairs program, CT21, with Eric Parker. Sponsored by Hartford Healthcare.
Good morning. October is here, and there has been some speculation that this month or perhaps next, coronavirus vaccines from Pfizer could be approved and available for children ages 5 to 11. But will they get them? A survey by Gallup published last Tuesday finds 55% of parents polled would have their children get the vaccine if and when it becomes available. Joining us this morning to talk about vaccinating children is Dr. Onyema Ogboagyu. He is the Associate Professor of Medicine at Yale and also the Principal Investigator for clinical trials for vaccines and therapeutics to fight COVID-19. Doctor, you were with us earlier this year talking about this very topic. You said it was promising, and now it sounds like we're pretty close to actually getting shots in some young arms. Is that correct?
Absolutely. So it's amazing how much progress we've made from the last time we interacted. And we're proud to announce that we have submitted some initial data to the FDA for kids age 5 to 11. We do remember that for kids above the age of 12, that there's an emergency use authorization for that group already. And so this is based on solid data that's been generated from clinical trials, which showed that for kids who are age 5 to 11, who got a third of the adult dose of the vaccine, that they had reasonable safety profiles and similar immune responses to individuals aged 16 to 25. We are also testing 1/10 of the adult dose in younger kids, those under age 5, and hopefully we'll have that data soon.
We started this segment by saying just 55% of parents said that they're ready to line their kids up. Does that number encourage you, discourage you? What do you make of that? Just over half of parents saying they're ready to get their kids that vaccine.
Yeah, that number is discouraging. I think that what's really worried us, frankly, is that with the Delta variant, we've seen that even in areas, both countries and jurisdictions with very high levels of vaccination, that there still continues to be circulating virus. So it seems that threshold for which we need to vaccinate individuals to, in the context of a Delta variant, needs to be very high. And because we know that children comprise a significant chunk of the population, I think optimizing vaccinations, within that age group will be important, and also critically important for halting disease transmission within the school systems. Now, my word out to the parents would be to remind everyone that, the Pfizer vaccine is a known commodity now, having been authorized and approved, subsequently for over 9 months now. And so I hope that provides an extra layer of reassurance that, the vaccine doses that were tested in children are safe and the vaccine should be effective.
Now, we heard you say, and I've read the reports, that it is a smaller dose than what adults are getting. What do you tell parents about that? And I know you're looking at even less dosing for even younger kids. Is there worries for those parents who are ready, they're eager, they're going to be knocking at that pediatrician's door to get that vaccine? Are they worried that that's not going to be as effective, or did your study show even that smaller dose really works?
Yeah, so the outcomes we looked at, given that we already know the correlates of protection with the antibody levels. So what we really looked at was to see if the antibody levels in the kids matched those of younger adults, which they did. And the reason for the dose reduction was actually to, again, try to keep the vaccine as safe as possible in some of the kids that really mount, exuberant immune responses to vaccines. And that's what we found in the study. So I think that dose de-escalation should provide some layer of reassurance that, the vaccines are safe, and we think that should have similar efficacy in those children.
A lot of what you're saying, I think, is a lot of what people are hearing is trying to reassure parents that it is safe. What about if you're a parent of an 11-year-old? Do you wait till they turn 12 and get them the full dose, or do you think just get the vaccine you can get when you can get it?
Oh, absolutely. Why wait? I mean, that no one can predict the risk of a child acquiring COVID-19 while waiting to turn age 12. And we know that children, with the Delta variant have, suffered significant consequences from COVID, including some hospitalizations as well as the risk of having long COVID. So my recommendation would be when you're eligible for a vaccine, receive it.
Now, we know we just talked about it being a lower dose. Is it still a 2-shot program? They'll have to go in and get 2 injections to get this to work?
Absolutely. So I think what's really emerged from not just our vaccine trial, but others is that what we call a prime boost, which means that you need a 2-dose vaccine schedule to optimize immune responses and maximize the efficacy of the vaccines. So we did test 2-dose schedules in kids as we tested in adults, and still with the same interval between shots, which is 21 days.
And what about for parents who see you, maybe even just, someone you know socially, and they say, but it all seems like it went so fast, doctor. I want to see, I want more people to get it. I'm just not ready. What do you say to reassure those folks?
Yeah, so again, we're now 9 months in from emergency use authorization. We know that, hundreds of millions of people around the globe and the United States have received the vaccine. And so I think that provides an extra layer of data from real world studies that the vaccines have been safe with a large scale rollout. And so I think some of those initial doubts are around just how quickly things evolved, should really be evaporating. And I think that it's really shown up in polling and also a rebound in vaccinations, especially the Delta wave, that people tend to be, becoming a little more confident in receiving the vaccines.
Now, you're an infectious disease specialist. This is your life's work doing this kind of thing. What has this experience been like for you personally? I mean, this must be the kind of, the big thing that you've been training for your whole life. I mean, has it been rewarding to be participating in this?
Oh, it's been absolutely beyond rewarding, but also tiring as well. I think, if we just flash back to March 2020, when we started to get reports of a new viral infection and hearing about just the morbidity and mortality that was happening in parts of the world that were hit before the United States, and then it got to us. And then having patients coming quite sick and not really being able to offer them any treatments, and also not even at that point having anything to protect vulnerable individuals against it. I think it's just remarkable how the work we've done has been able to shed some light on treatments that work, but also highly effective vaccines. And even though, the vaccines development process occurred pretty rapidly, we can clearly see that the safety and efficacy of those vaccines are just stellar.
Now, we are close to having shots in young arms, as I said earlier, but in the meantime, masks, is that still your recommendation? Parents keep the kids in masks?
Absolutely. And I want to emphasize that because we know the jury is no longer out on masking in schools. I think this week we heard about 2 important CDC studies that showed, one was in Arizona that showed that schools that enforced masking prior to school opening had much lower cases of COVID-19, lower outbreaks. And also another study looking at multiple counties in the U.S. showed about a 50% reduction in cases among schools that enforced masking as against those that did not do so. So again, while we wait to vaccinate some of our younger kids, which will take a while to come, I think we should do well to encourage mask wearing.
All right. Great advice, Dr. Onyema Ogbuagu, Principal Investigator for Clinical Trials and Vaccines and Therapeutics at Yale. We appreciate you being with us, and I'm sure a lot of parents were paying close attention to everything you had to say. Thank you very much.
It's always my pleasure.
Later in our program, are Connecticut's toy sellers concerned about having enough product for the holidays? They'll share their take on reports of supply chain issues that might impact availability. But next, $1.5 billion will be moved into 2 of the state's pension plans. Find out how that move impacts all of us in the future when we come back.